topical anesthesia, the dental block, which we'll probably demonstrate today. For those of you who don't do it, it's very, very simple. Now, I've done lip augs and PDO with BLT, just applied to the lips, and it seems to do it. If it doesn't, then we do the dental block. Dental block, you're going to use about a cc of 1 or 2% Lido with a 27 gauge, 1 3/4 inch needle. You just lift the lip, you go right by the canine, aim towards the infraorbital notch. You can put your finger, and that's your end point, because that's the nerve, and you're just going to go right close to the parallel to the bone and inject as you come out. Now, they make a topical that you can called Topicaine, which you get at the dentist. You put it on a cotton ball and put it, and it pre-numbs the gum, so you can get that's available. The only flavor that's tolerable is pineapple. The rest of them are really gross. But you could put that in, make it a little bit, and the same, the canine, the lower canine. You go straight towards the mental foramen and inject a little bit in each side, wait till they get numb, and then you can do the procedure. Problem is they get a little droop, just like the dentist, so it's hard to tell sometimes whether the droop, especially if you do a little bit too much, you get an asymmetric droop, and you don't know if it's your PDO threads or if it's the effect of the anesthesia. But like, you're just using plain lidocaine. You don't have to use epi, so it won't stick around that long. So unlike a dental procedure, you're going to be done in 5 minutes with this. So you really just need a light anesthesia. The lips are remarkably fast, and so that's the dental block. The transcutaneous we already talked about. You're going to do the consult, and that's what we're going to do today. The consult is basically your assessment, whether you charge for it or not. Some people do free consults in aesthetics. Some people charge $150, which is applicable towards the procedure if they go ahead with it. It's your choice, it's your demographic. But anyway, you're going to do the consult. During that consult, you're going to look for innate asymmetries, and you're going to document them, either on paper or hopefully with photographs. I typically don't take photos until people actually decide they want to do the procedure. But again, I'm going to make note of it, because people are going to say, "Ooh, I've got this wrinkle now after your procedure," and you show them the before picture and say, "You always had it. It's just the rest of you looks good now," and the eye is being drawn to that. But you have to document these innate asymmetries to be able to defend whether you created it or not. And photographic evidence is really your best. And we'll talk about pick stitch, where you can, in a matter of seconds, bring up the before and the after photos side by side for comparison. You want to ask some questions. They don't need a full H&P. We're not doing heart surgery. But you want to ask about the prior cosmetic procedures. I want to know if there's any scar tissue in there. I want to know whether they've had any problems with anesthesia, including local. I want to know if they've had recent fillers. If they have, which ones? Were they deep volumizers that I don't have to worry about? Or are they dermal fillers that I'm going to be pushing a needle through? So people coming to your office, one of my first questions is, have you ever had cosmetic procedures before? Some people say no. Some people, yeah, I've had Botox, I've had fillers. Some people say, yeah, I've had a chin implant, I've had a cheek implant. Are they allergic to lidocaine? Do they have easy bruising? Now, part of the inflammatory, and poor healing, part of the inflammatory reaction, when I try to tell people, well, how come I'm still having pain a week later? I don't know why you're having pain a week later, and the person I did yesterday stopped after 3 days, and she's feeling fine now. All I know is people heal at different rates. Some people cut themselves, 3 days later it's healed. Some people 2 weeks later, it's still healing. If you have a sluggish inflammatory reaction, if you have a sluggish immune system, or if you have a hyperreactive immune system, these are the things that come into play. The things that are totally outside of my control. You may be a slow metabolizer. You be on medications that are either enhancing pain, and I don't know if people know that opiates actually reduce your threshold for pain tolerance, actually make you more sensitive to pain. So people who are on chronic opiates, again, Los Angeles, they may have actually more pain than less pain compared to this. And we'll talk about some of the pain control issues today and tomorrow. But I want to know whether they bang their knee, does it bruise easily? Because when they have dental procedures, have they ever had any problems? So just quick history about the basic things about healing. It's hard to get a pain profile. It is very hard for me because 80% of the patients do absolutely fabulous with this procedure without complaints. Others come back and they go, why didn't you warn me it was going to be so painful? I couldn't warn you because I didn't know. I honestly, it's not like I'm doing surgery and I can tell you, you're going to wake up and you're going to have pain in the incision site and you're going to have pain with movement. All I know is we're putting foreign bodies in your face, and when you move your face, you're going to feel them until your body starts absorbing them. Are you willing to accept that for what people have had filler understand that? The difference is, filler has lidocaine in it, so they don't feel it as much. But we'll try to make this as painless a procedure as we can. Realistic expectations. That's probably the most critical. It's hard to teach from the front of the room. When I sell it, I'm selling the benefits of thread lifting as a unique way, the only non-surgical way to give a surgical appearance. And you pay a price for that, When people say, well, I don't want any pain. I say, here's my card. It says physician, not magician. I can't make you magically overnight youthful. It's a process, and your body has, just like a surgical process, there's a recovery time. It's not as prolonged or as severe as a surgical, but you're getting results that mimic surgical results. And your body has to go through an adjustment period. So you have to have realistic expectations. You're not going to look 10 years younger. You may look 3 years younger, 5 years younger. Like I said, I don't want people looking, you don't want to look that radical. You want to look, and it's going to gradually, that's why they make Sculptra. They don't want people to go into work, be hollow-cheeked one day and the next day, full. They want it to gradually, over 4 to 6 weeks, with Grecian formula, that's their formula. So you gradually change before people's eyes. A consent form is absolutely critical. You have to have someone, I don't know if we have samples of them, but we'll provide samples of a consent form, which you should have everyone sign. Just like any other medical procedure, you're using sharp objects and you're poking holes in people. And most everybody, those of you who are new to the aesthetic field, you'll soon find out that not everybody in the world is honorable, and a lot of people get a procedure, come back to complain, and now they want free care. Now they want you to make up for their pain and their suffering, which they hopefully signed on a consent form that they will have pain, they will have bruising, they will have swelling. Now they want free care because they have suffered so much. So we have to be aware that those people do, or we have to document. It's not, our risks are not medical legal so much as they are dealing with humans. It's just part of dealing with the aesthetic population. Screening for body dysmorphia, the same as you would any other procedure. People who have unrealistic expectations. People who come in and they say they've been to every aesthetic center in town and no one's giving them exactly what they need. I mean, there are certain red flags that if you haven't developed them, you will. Again, the consent form, you're covering yourself for the aggravation factor, pretty much. There's minimum legal risk. If done correctly, you'll have no lasting damage. Pre-procedure photographs, to me, are critical, for a couple of reasons. First, to document, so when they come back and say, I never had this before, you could show. But secondly, everybody that I do, if they don't leave with it, I text it to them before the end of the day, a before and after. Because typically, I'm not always, what's interesting, you don't always get the effect you expect. And I sometimes, what's really interesting, I get a effect, I look at them and they look in the mirror and they go, wow, that looks great. But then I put the side-by-sides together, the photograph doesn't show it. They look unchanged. But they're happy, I'm happy, so I lose the photos. It's, I don't know what happened, I had a digital meltdown. But documentation of before and after, absolutely critical. Marking the patient, we're going to go through that today. We use, don't use surgical marker, the ones you use in the OR. Yeah, they come off, but they come off with a lot of rubbing. And you'll see after you put threads in, people are a little tender. There are a number of, Cosmo France makes these markers. They come in 3 different colors. They come red, blue, and green. They're not inexpensive, but they're reusable. They are not, again, this is not a sterile procedure. This is a clean procedure. Now, I've done preceptorships with plastic surgeons that have made this. They put gown, they drape everything, and they put gown and glove. And they, well, how come you can't make an incision and pull the thread? Because it isn't a surgical procedure. They want to make it a surgical. It's a clean procedure. This is like injecting a joint. This is like putting filler in. You know, you don't lick the needle before you put it in. It's and sharps control, especially here in a training situation. We are, you know, we be concerned about infection management. So the basis of healthcare, you know, whether you call it med spa or not, we're still in healthcare, and we still have to represent. We're still being held. We have licenses, so we have to protect those licenses with due diligence, taking consent forms, sharps collection, cleaning up blood, those kinds of things more seriously than spa owners, where the worst thing that happens to them is they close up and they open up in another town or another state. We have greater consequences. But these pens are good, and they come in 3 different colors, which are good because if you want to mark up your patient with the barbs, where your barbs are going to go in one color, and then where your mesh is going to go in another color. This is a good pen, but not so good on African Americans. So the white pen is really good for that. The green is festive. So marking the patient. Typically what I do is I mark the patient, I have them with a hand mirror, I lift up and say, so this is what you'll be happy. Now if a patient, how do you tell if it's a good patient? If a patient says, I don't like this down here, if you take your finger and go, would you be happy with this? And they go, yes, fine, sign the consent. If they go, no, I want this swept back, I want all of this gone, wrong procedure. It's not going to give you that, and I'm not going to promise that to you. This is realistically what you're going to get from threads. You know, they just don't have the power to hold up tissue that much. Even, I mean, there are guys you can put Fortes, the 18 gauge in the face. They do that a lot. Massive inflammatory reaction and more pain because it's not as flexible as the others. You'll get more lift, but you pay a cost for it, pay a price. We'll go over measurements. People do it differently. The guy in Korea takes a ruler and he measures 3.5 inches, and he marks dot, dot, and that's where he puts in his thread. What I do is I don't care where my portal is. You'll see when we do hands-on. I care where my needle tip is going to be. So if I want to come up to the end of the smile line or over it, I'm going to take a needle still in its sterile sheath. I'm going to lay it where I want the point, and I'm going to lay it down. And I'm going to mark where my portal is based on that. That's a step people forget. They do their schematic, get everything ready, numb up the patient, and they go, oh, I just estimated where my portals were going to be. I never really measured. So it's the marking up, then the measurement, then the injecting. But local anesthesia, we recommend lidocaine with epinephrine. Apparently that's getting harder to find these days, but epinephrine, again, it acts as a vasoconstrictor, also leaves a little blanching mark that takes a while for people to go away. So you want to be sensitive about that when you do your after photos. If they can sit around in the office with some ice on it until that goes away, makes for a much more pleasant photo. I use a 30 gauge, either 1/2 inch or 1 inch. You know, basically a Botox needle. That's what I tell people. You ever had Botox? It's a little stingy. You can mix sodium bicarb with your lidocaine, cuts the burn a little bit. Your pilot hole, you're using a gauge larger than your thread size. You know, I typically use an 18 gauge needle because I'm typically using a 20, but you could use if I'm using a 2390 on thinner skin, skin, I may use a 21 gauge needle rather than an 18 because everything is more delicate. We're passing through, we'll go through this, how you know if you're too deep. Patient says, ouch. And be aware, some people are stoic. So watch for the flinching. People sometimes won't grimace and won't say ouch, but just be aware if their hands start clenching, you know, am I hurting you? If you're hurting them, you're probably too deep. You've gone in and the needle is dived into the smaz and it's causing pain. So you back up about 2 millimeters. Now it's a flexible, so if I'm too deep, what I want to do is lift the hub of the needle, which causes the tip to come up, and I come more superficial. If I'm taking it and I see suddenly it's tenting the skin because I'm monitoring with my left hand, and we'll go over this, I'll talk my way through doing it here. If I feel it's getting too superficial, I do the opposite. Depress the hub, the needle dives. So you're kind of riding the contours of the face. When you get out to the arch, if you keep going straight, you're going to go right off to the corner of the room. So what I do is I put my finger gently over the end of the needle, and as I advance, the needle is just riding into the convexity over there. So I'm not going to go too superficial. I'm helping to guide the needle with my finger. So, but all this is on the hands-on. Again, This was written to have as a manual when we leave. So it is not a, how many people are, is anybody left-handed in here? Okay, right-handed, a group of right-handed, all right, you're left. It's not it's mainly a left-handed procedure. You're not jamming this thing in, although you watch some videos and people are boom, boom, putting threads in at a remarkable pace. What you're doing is you're using the blunt tip of the cannula to spread the tissue, and you're drawing the tissue over the barbs with your left hand. The effect is really the net redrapage of tissue over the barbs. So when you get to the end and you think you're done, you take the tissue and you feel a little pop. Then you pull out. So you've accumulated that's where the lift comes from. You're lifting it, and when you pull out, all those barbs are holding that tissue up there. People say, where am I going to get these big wrinkles? No, the lift is not that hard. Now, if you too aggressively massage before the needle comes out, yeah, because then you're pushing all the barbs together and you're going to accordion the tissue. That's a technique thing we'll go over during the hands-on. So I'm just making you aware of the order in which we do things, but the left hand does not remain, or the right hand if you're left-handed, does not remain inactive. You're monitoring, you're pinching so the needle can go through, you're drawing the tissue forward, you're monitoring where the end of the needle is. And this hand is just gentle forward pressure. You're not ramming it, you're just drawing tissue through it, so you're trying not to traumatize the tissue. Anchoring the thread, we'll go over that. Especially in the face, you don't put your finger pressed down on the needle. That hurts. It's pressing right against the periosteum and people will feel pain. You're really getting to remember it's the needle and a little loop of thread. You're trying to trap that little loop of thread so when pull the needle out, you're holding the thread down. And as you pull it down, then you're going to follow the needle. I've seen people massaging the needle as they're pulling out. It causes pain. It's also not doing anything. You want to follow the needle, never be behind the point, pushing the barbs in. So just things you get aware of. When you put it in, we rotate clockwise, counterclockwise to engage it, hold it down, pull it out, and then we'll work on we'll hammer that a little bit harder. Okay, and massaging, again, depends on what you want to do, and using gel helps. Most people use massage gel. It's cheap. A lot of offices already are using it for other procedures, gel for your radio frequency or other procedures. So if you already have gel, just a little bit on the finger, it just acts like a glide. Because again, the face is sensitive. Once you put a needle in, putting a little glide in, and it's even better to take a gauze pad, dip that in, and the bluntness of the gauze pad is not quite as painful when you're engaging those barbs as it is to just take your finger and really rub it in. It's more important in the body because the muscles, the tissue is deeper. And we had a lot of people leave last time after the training and complained about a lot of pain in the knees, and they massaged their own knees and they felt pop, 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 and all the pain went away. Cutting the sutures, again, I recommend curved scissors. I don't know that they have them here today, only because in the beginning, you're really nervous. There's a technique for cutting the threads, which I'll demonstrate. When you pull the needle out, there's going to be a little bit of thread left. You're going to lift that just enough to tent the skin. You're not pulling it, because when you pull it, that's when the tissue accordions. And if you let go, you're going to end up with all these curvilineal wrinkles there. Just lifting enough to tent the skin. You're going to take your scissors, depress the skin a little bit, so when you cut it, the skin pops up and hides the tails. If you don't do that depression, or if you don't pull, if you don't do that action, you're going to end up with people saying, wow, I'm feeling the ends of the tails here. And now you're going to have to go in with a forceps or a hemostat, pull it out and snip it. But it's unavoidable. So we'll go over that technique. You can apply, you feel, and at the end you feel for it. It's easy, because if you run a 4x4 over, if there's an exposed tail, it's going to catch. You're going to feel it on the 4x4. And again, if it's present, you grab the end. So it's a remediable problem. Apply topical antibiotic or arnica to the portals. Frequently, I will do one side, have the person hold an ice pack, and then while I'm doing the other side. So it keeps them occupied, and also swelling, it's a foreign body reaction. So mid-procedure photos, that one that was in the beginning that showed half the face done, I typically will stop halfway and I'll show the person, even before I've cut the threads, look at the difference. And they'll, oh my God, this is what I like, and gets them excited. And now they're more willing, especially if they're a low threshold pain person, it gives them a little enthusiasm for to go through the rest of the procedure. And then complete the other side. Evaluate for symmetry when you're done. This is why I typically don't cut the threads until I'm done, because as long as they're there, you can remove a thread if you don't like it, if it turns out to be too superficial, or if there's an asymmetry, you may have to put a little bit of tension. Once you've cut the thread, you're committed. They're in there. There's ways to remove them, but they're not easy, and they're not without a cost. Some faces need a different number of threads in each side. People have asymmetric faces. For some people, it's the side they sleep on. For some people, it's the left side of their face that gets a lot more sun damage and is a lot more wrinkled. Smokers are going to have more fine, crinkly skin. So evaluate for symmetry, because there's no rule that says you have to put 3 on each side, on your trivector. I routinely put 3 on one side, 4 on another. Sometimes I'll get that jowl, I could do a little bit better with another thread. We'll go over costing so that in your mind, if you're going to, because there's different ways that people have of pricing this procedure. But the only point of this slide is you don't have to be stuck on 3 and 3. Sometimes we're correcting innate asymmetries that the person had, and you're making them more symmetric. Sometimes we're correcting our asymmetries, which we created in our lift. And when we do the other side, we look and go, oh, I got a little more lift on the left side than the right side. How am I going to correct that? And that's what the hands-on portion is today, because we have advantage of everybody's models to say, okay, this is how you handle these problems. You can add additional threads. You post photos. We talked about the pick stitch. It's great for building your practice portfolio. Take photos of your models today. They've signed model releases. Take a before photo, take an after. This is the beginning of your portfolio. Patients don't want to see, when they come to me, they don't want to see Miracuse results. They want to see the results that I had. They don't have to know that it was my very first patient and that it was a training. All I know is I can say, I put those threads in, this is the result I got. And you start building. Now, until you build your own, you may rely on other photos that other doctors at Apollo Med have done, and we make those available to you if you want them. But it's good to start getting your own, because it builds your confidence, and it's a brag book. And patients will take those side by sides and show their friends, and that's what builds a practice too. Aftercare instructions. These are the general instructions. No swimming, bathing, meaning submersion under the water, especially with body threads, but you don't want face under the water. I live in Los Angeles. Some people, that's the hardest thing for you. I mean, I can't go in the ocean for 3 days. No, you can't. You have a risk of infection. You have a risk of thread migration if there's too much activity. They say no alcohol, cigarettes, or sauna. I don't know. I don't recommend it for patients, always worked for me, but no heavy exercise or sweating for 1 to 2 weeks. Minimize active and passive motion. You're going to see aftercare instructions say no smiling for 2 weeks, no yawning for 2 weeks. Best of luck with it. Don't sleep on your face for a month. They're after instructions. Yeah, in an ideal world, they would. It's hard to counsel people on how to sleep. I wake up and I am where I am. No deep facial massage for 2 to 4 weeks. This includes microneedling. This is why microneedling should be done first. You can do a thread lift right after you've done microneedling, but once you put those threads in, you got to wait a month for microneedling. We're going to get into the packaging, but that's why it's up there. So no deep facial massage of any sort. Antibiotics are optional. I don't tell someone don't. I tell people you don't actually need it. I don't routinely dispense them. I've never had to give anyone antibiotics for an infection. I have not myself had any serious complications from threads I've put in, but because I teach beginning classes, I see a lot of complications and handle them over the phone. So that's why I try to bring that here. Trust me, I had my share of poor outcomes when I was first learning. I'm not saying that I'm a master at it. I'm saying I've been blessed. I haven't had any of the complications that people raise questions. Not that I couldn't, but I've been blessed in not having them, but helping other people avoid them is a better road to go. Ice is absolutely essential. It's an inflammatory reaction. The more you keep ice on it, it's just like spraining your ankle. The more you keep ice on it, the more comfortable you're going to be, the less swelling you're going to have. You can use Tylenol, you can use anti-inflammatories. No laser, IPL, RF energy treatments for 4 weeks. Aftercare instructions further, you warn them we're going to have mild swelling, erythema, brucis. They're going to have brucis. And I haven't seen that's rare. And pain might last a week. Pain actually might last 2 weeks, depending around and people always say, how long is the lift going to last? No different than filler. Areas of high animation break down faster than areas of low animation. Perioral work's going to break down faster than foreheads and flat planes like necks. But we'll talk about advanced aftercare instructions tomorrow because you really don't need a lot of that for the face and the neck. They're going to feel discomfort like pulling sensation or irritation. It might occur while moving the face, 2 to 4 weeks. We heard Kelly's story. If a dimple or protrusion develops, contact the office. These are instructions that you give the patients. Now, 10 most common complications. Track too deep, the thread's too deep. You'll know that immediately. The patient's going to say, ouch, and you can't go any deeper. Thread track too superficial. You're going to feel that, and you're going to redirect. We'll go over, you can only pull back about 2 millimeters. You already went up how to redirect, but if they're too superficial and you don't take care of it, this is what you end up with. You end up with someone, this is days after the person called me who put these threads in. It's a colleague of mine who took the Nova Threads course. The Nova Threads course, at least where I took it in Los Angeles, if you don't bring your own model, you don't get hands-on. You get to watch. She didn't bring her own model, so she basically audited the course, had never put a thread in. Even at Empire, they got to put 1 thread in. They got no thread experience, so she thought, that looks easy. Looks easy enough, let me put threads in. She used 19 gauge in this very thin Asian woman, and this is what, they looked at tiger strikes. Then she tried to help it along by doing radio frequency, or Althera. She has an Althera machine. Althera, so she partially melted them. Then she went in and tried to dig them out. So this is what it looks like if you put threads in too superficially and don't take them out right away. This person will have that look for probably the next 3 or 4 months. Bruising is pretty, I won't say common, but it occurs. Swelling is, not always, but.
I got it.
Oh, you got it. I thought it was, okay. That's bruising following the track. Sometimes bruising occurs like everything else. It tracks through the fascial planes and collects in the jowl, so people get bruising. And they get bruising in the same areas you get with filler, under the eyes, around the mouth. It's where it's really, really vascular. Okay, next slide. Swelling goes down with ice. Just make sure it's not a hematoma, because people do have bleeding disorders that they don't know about. Hematoma. And facial asymmetries. I'm not talking about innate asymmetry, I'm talking about asymmetries that we created with our lift, and the patient goes home and looks in the mirror and goes, wow, my one eye's up here. It's no different than Botox, because one eyebrow's up here now and it always wasn't. So there are things, it's a complication. It came out. All right, what this doesn't show is, yeah, you'll see it tomorrow. She has a big hematoma on her forehead from someone trying to dig out a too superficial a thread a little too aggressively. Thread extrusion, splitting, this is common where people say, I had the lift 2 days ago and about 1 inch of the thread is sticking out now. Again, it's an anchoring issue. Here's a thread sticking out of the portal. Patients will come into the office, no problem, you just snip it, same as you would, the body spitting it out. Dimpling of the overlying skin. This happened because the person yanked too hard when cutting it, and it accordioned the tissue and it didn't relax. And typically, you can massage these out and you'll feel it propping. You separate the tissue. We'll go over that today. If not, these things frequently go away on their own within the first week. Don't panic. Tell the patients, apologize. It will probably work its way out. If it doesn't, then you can go in and try to break it up with a little saline injection or again with the 21 gauge needle. The protruding pointing end of the thread, we see that. It happens again, that's the end of the thread. Poke a little hole, and if you can grab the end with either a jeweler's forceps or a needle nose hemostat, pull it out and snip the end. Otherwise, we do what's called subcision, where you make a little hole and you go in and you sweep under where you think the thread is. You're trying to undermine the tissue, give it a space for the thread to go in. And if you leave a depression, then you can always put a little filler in. but you just want to try to get the cosmetic end. This doesn't show very well. It's the corner of a mouth. That's her lip. This is the right side of the face. She's got a little neuropraxia, just a little weakness there. It went away. And I actually injected some Kenalog, and it got better right away. So it was treated. But she was done by an RN who had an MD. Her supervising MD didn't do PDO threads. He was he was their med spa's doctor. So he didn't feel comfortable treating a complication. That's why I treated it. But it's the only neuropraxia I've seen in the years, but it is a complication. Timeline for other modalities. I'm sorry this is so small, but it will be in a book. Neuromodulators, Botox, Dysport, Xeomin, you wait 2 weeks after threads. Dermal fillers, HA or the calcium hydroxyapatite, 2 weeks. Unless, as we said, you do the alternative techniques and as long as they're not crossing a filler, as long as they're not around where you have a thread, you can do it the same day. But if you're going to put them in the smile lines and you've gone past the nasolabial fold, you got to wait 2 weeks. Dermal volumizers, on the other hand, you can do immediately. Sculptra, Voluma, Restylane Lift, or Biogel, like we're doing here. If you're not using it to fill lines, if you're using it as a volumizer, that can be done the same day. You're in 2 completely different planes. You're under the SMAS. Kybella deoxycholate, wait a full 6 weeks. Microneedling, 4 weeks. Again, if you do microneedling, I did 3 threads in a woman last time I was here that had the microneedling in the morning.
Yeah, we did her over here, and then she came over.
She came over and had, so you can do, I have no problem doing it the same day because I'm tunneling under. And the microneedling is only going down with 1.5, 1.8 millimeters into the skin. But once you put those threads in, you don't want to be microneedling for weeks. So just in terms of your thinking and packaging. Laser, 2 weeks. RF to HIFU, 2 to 4 weeks. It's your judgment. If you can wait 4 weeks, it's probably better. Laser doesn't go as deep. Laser is more dermal, epidermal. The RF and the HIFU are down at the SMAS. So they're targeting through the thread. So you may want to give it the benefit of the doubt and wait 4 weeks. But you will see out there 2 weeks. So I put that range in. The most common procedures, this is my personal experience, and if anybody else has been doing them and has something to add, but most of what walks into the office wants mid-face, lower third, jowls, neck. They come in wanting filler for their lip. But when I look at it, I go, it's really your lip is a little thin. The quality, sometimes they have volume issues with the lip. Sometimes, the lip is really shrunken and there's vertical lines in it and you really do need to plump them. But a lot of times the lip looks good, it's just too thin. So we do the lip flip, which is you put a screw thread right along the vermilion border and it lifts it up and gives the optical appearance of more upper lip and it balances it beautifully. Or do both. You can do both, yeah. Glabellar folds. People come in, they want their 11s. Again, if you don't feel comfortable around the eyes, especially with filler, you're never going to have the occlusions or the granulomas like you have with the risk of filler around the glabellar, but you can use Botox. But these are the things that come in, and brow lifts. People come in because they say, I look tired all the time. What can you do for me? Can you put filler in? And a brow lift, well, it's subtle. We have some photos tomorrow when we talk about brow lifts. The result is they're not going to look wide, deer in the headlight. They're not going to look, but it's frequently the difference, and you'll see on the close-ups, of someone with a hooded brow where you do a lift and suddenly you can see the upper eyelid. It's subtle, but when you look at them, they don't look tired anymore. Their eyes look more wide open. Competitive procedures. You can always use neuromodulators in the upper face. You can use fillers and volumizers in the mid face. The lower face, lower third and neck, this is really where you have no competitors to threads other than the surgeon. And if people want a surgical facelift, or if they're really a candidate for one, then by all means send them to the surgeon. Maybe you can work out a relationship where he'll send you his non-surgical work. But my point is, there's no competitors in the marketplace for what threads do that I'm aware of. Even Ulthera and HIFU, you can get some tightening, but you're not going to get that sharp jawline. Maybe in the marketing photos they show that. I've never seen that in real life. In real life, the results are usually much more modest. And I may want to do that after the threads or before to prep the tissue to tighten up a little bit so I get more lift with the thread, but I don't compare the results someone can get with RF or with Ulthera to what they can do with threads. I consider them complementary. I don't consider them competitive. I wouldn't advise someone, if someone wants a sharp jawline and this swept back, I'm going to tell them threads. They're going to get the result right away. It's healthier for them, and they don't have to go through multiple sessions. Yeah, and they can come back. Exactly. Oh, yeah. Okay.